phase, we're going to review the client's previous medical record if there is any available or present. Then we're going to determine the scope of assessment that we'll be using or needed. Then we're going to prepare the equipments required for the assessment. Then we're going to perform hand washing. Okay, so good morning, sir. I am Haril, Sigasig, your student nurse for today. May I know your name, please?
My name is Haril.
Okay, your birthday?
March 2, 2003.
Okay, so how do you like to be called during the assessment today, sir?
Just call me AJ or Alton for short.
Okay, AJ, we're going to assess your health history for today. I am going to ask some personal questions such as your biographic data and your present health history, your family's health history too, and any other else. And I am going to take note of these for the future findings or observations. So before we start, can you understand Tagalog or English?
Yes, I understand.
Okay, so you may speak using those languages whenever on which you are comfortable with. So, do you have any questions or clarifications?
So far.
Okay, none. So we're going to. So are you? Before we start, are you comfortable in your position?
Yes, I am perfect.
Okay, so we've already secured the room and adjusted the room temperature. So now we're going to start. So sir, your name is, what is your name is again?
Elton Genji.
Okay, your age?
20.
20. Okay. Your civil status?
Single.
Single. So okay. So your birthday is again?
March 2, 2002.
Okay. So what brings you here today, sir?
I've been experiencing severe cough.
Okay. So how long has been already this?
It's been 3 to 4 days already.
Okay, 3 to 4 days. So do you have any other symptoms aside from that?
Aside from that, I've been experiencing also front nose.
Okay, so when does your cough start or gets worse?
Usually it's worse. Usually before I sleep. That's why it's hard for me to sleep properly.
Good. For sleeping, so do you have any other concerns regarding your cough? So how about your nose? Okay. So from a scale of 1 to 10, how can you rate how bad your cough is?
6 to 7.
Okay, 6 to 7. Okay, so do you have any other pain in your body?
No.
Okay, no. So did you take any medications?
No.
No medications? Okay. Now we're going to proceed on your past health history. So have you ever underwent some surgeries?
No.
Okay, you haven't? So do you have any allergies?
No.
So, okay. So did you have or took some immunizations? No? Okay, so what about past illnesses? Okay, so for your current lifestyle, what do you do?
Usually work out 3 to 5 times per week.
Okay, 3 to 5 times. So what kind of workout do you do?
Lifting or cardiovascular activities.
Cardiovascular activities. So for you're going to proceed for your psychosocial status. So did you take any alcohols for the past few months?
Yes.
How
diagnosed with high blood.
So your father is high blood. So how is this the only sickness that they've encountered?
Yes.
Did they underwent in any surgeries?
No.
Okay, so do you know what medications did they take?
I don't know what they pay for their health.
But they have
Supplements
medications
or
or
supplements.
yeah.
Yes.
Okay.
Maintenance.
Oh, so what kind of maintenance do you Is it for your high blood or blood sugar?
Maybe.
So, okay. So, is there any other sickness that is running in your family? Other side of your family?
No, aside from that.
Okay, so that's it. So now we're going to take the patient's vital signs, which is the blood pressure, pulse rate, heart, respiratory rate, and temperature. And now I'm going to ask his height and weight, so I could compute his BMI. So, sir, may I know your height?
5'6" or 167 centimeters.
Okay, so your weight is?
75 kilos.
So in the summarization, I'm going to explain everything. So So, to summarize, so you were experiencing severe coughing, and it's already been 3 to 4 days since it started, and you have a runny nose along with it, and your coughing gets worse before you sleep, and you rated how bad it is by 6 to 7 in a scale of 1 to 10. And you haven't taken any medications yet, and you haven't been admitted in your past, and you haven't experienced any illnesses or any other worse sickness, and your current lifestyle, you work out 3 to 5 times a week, and you've been lifting and doing cardiovascular activities, and you're only drinking alcohol once or twice per month, and your family history is your mother has goiter and your father has high blood. So okay, so is that all? Okay, so a doctor will come to you and prescribe you with medicines that is suitable for your sickness. So I'll be right back, sir. Okay, sir. So the doctor had prescribed you with medicines for your cough and runny nose. So you are expected to at least stay at home for now and rest, and After the assessment, we're going to perform hand hygiene or hand washing, and then we're going to document the results or our findings on the client's record.